Hi, and Melissa will start us off.
Hi. As many of you know, we've been working to develop the web-based form, the PRAF 2.0, but in the meantime, we have a new ODM form that's replacing the old ODM 3535, which we called the PRAF, for Pregnancy Risk Assessment Form. You'll see the link on the screen that shows you how to access that form, and the number for the form is 10207, and instructions for using that form can be found in 1007I. So that form looks just like the skinny form that you've been used to using for the progesterone PIP. And the instructions, the only difference for the instructions is we had to do the layout a little bit differently so that everything would fit onto two or three pages. And it also has the added instruction of how to let the county know with the paper-based process, because we have providers outside of our 23 OPQC sites that are using that paper form and don't have the managed care plans calling the county on their behalf. So that's a little bit about the paper form. The PRAF 2.0 will be launching on the NurtureOhio site, which we will have a link from the Medicaid site to that site at a later date. But on June 5th, it will be posted on the NurtureOhio site, and you will have the ability to test that out and see how it's working for you using real data. We'll follow women that you enter all the way through the process to make sure that the county is notified and that the managed care plan is notified. And then if you enter in a home health referral, that is going to the appropriate entity. We are not using the eFax prescription at this time. We received a lot of feedback from you that was not working well with the different challenge questions that you have to answer for each prescription that's submitted. So we still have the prescription functionality in NurtureOhio, but it is your option whether you want to actually fill out the prescription information and print it and fax it to the specialty pharmacy, or if you prefer to use your EHR for that activity. Next slide, please. This slide just shows how when you enter in a form, basically all of the recipients, which are kind of indicated by those airplanes, receive a notification at 2 o'clock on that day that a new form is entered into the system. So the county of residence for the woman that's been entered in will receive a notification saying that there's a new Medicaid eligible member that is pregnant, and to update her eligibility record in Ohio benefits. The managed care plan will receive a notification saying that there are new members information that needs to be downloaded to integrate into their care management systems. If you're using the form as a home health referral, they'll receive a notification that they have a new referral that needs to have the home health nurse schedule a visit. And then as I said earlier, the eFax capability is delayed, but you can still print it off and use it as a prescription. And also, we are actively working with our Department of Administrative Services to get the information to go directly into benefits.gov, which is our eligibility system. Next slide, please. So in order for our eligibility system to be updated, we really need to have the Medicaid ID, which still has the old name of it as MMIS number on the patient's Medicaid managed care plan cards. So this slide just shows you where that number is located on each plan's card. You'll notice Melina's number I think it does say MMIS number, but it is actually exactly the same as their managed care plan ID. They use their managed care plan and ID and the Medicaid ID interchangeably, and that's actually best practice where we would like all our managed care plans to go. But currently, if you could please enter in the MMIS number so that we can keep women from losing eligibility during pregnancy, that would be a very nice benefit of this system. If you enter in the managed care plan number instead of the MMIS number, we won't be able to do that, especially when it integrates with Ohio benefits. The other piece that we really need for making sure that women don't lose coverage is an estimated due date, so the estimated date that the baby will be delivered. You don't have to know the exact date. You just need to put the estimated date of confinement on the form so that the county worker has something to enter and she doesn't lose coverage. Next slide, please. So now I'm going to turn it over to Sean to demonstrate the NurtureOhio PRAF 2.0 system.
Perfect. Thank you very much, Melissa. We'll just give a second here, and I will share my screen so you guys can see all the different steps I walked through. Basically, what we're going to do today is kind of just show you the website, the login screen, and sort of walk through some of the different sort of components of the form, just to sort of get you a little more familiar with it. Melissa has created a desk page for it that will be shared, and so don't worry about, you don't need to frantically take any notes. We'll have some screenshots in there and whatnot to assist you. But just wanted to get this opportunity as a time for us to walk through it, ask any questions that you may have about logging in, about accessing forms, continuing forms, all that kind of stuff. So as I'm going through this, please feel free to jump in. I'll try to stop a few different times and see if there's any questions about what I'm walking through. But if you have one and you don't want me to jump onto the next section, feel free to stop me in the meantime. So this is the, can everybody see my screen? I guess the first question.
Yes.
Yes. Great, great. So this is the screen you'll see when you go to NurtureOhio.com, which, as Melissa mentioned, will be linked from Medicaid. So this is what you'll see the first time you arrive there. One thing that I want to note is the first difference, as you can see, sort of from the descriptive text. You want to select MITS, all the different practice users and whatnot. You'll be logging in with your MITS IDs and password. So you'll select MITS from this drop down. I do not have a MITS ID, and so for the purpose of this demo, I will select the internal option. One thing to note is while there is a forgot password option here, if you are using your MITS ID, all of that will be hand-built through MITS. So if you forget your password, you want to change your password to something else to make it easier for you to remember, all that can be done through the MITS website. And any questions around that, I think Melissa has information around sort of who people to contact or the website to contact about those issues. So we'll go ahead and log in. This is the screen that you'll see the first time. This, all this information here will be populated with information that we'll pull from Mint. You will not have a new password box here, just as I mentioned. You won't be able to change the password through this site, so that won't exist on your login. And immediately below that, you'll have these two different sections: the practice information section and the prescriber information section. First thing I want to say is these are not required sections. So if you don't know some of the information as you're looking at it, that's totally fine. But I do want to sort of stress the benefit of them, and that is anything that you enter here, so the first time that you log in will be, you can access it when you're going through the form. So instead of having to fill out practice address and prescriber information and other information throughout the form, you will be able to just enter it here one time, and then every time you're entering a form for Dr. John Smith, you'll be able to select him from the drop down and not have to worry about typing in any of his NPI and that sort of information. The other benefit around this is it will sync to other users that are kind of fall under the same MITS administrator. So there's 4 nurses in the office, and you guys are all going to be entering in the different forms. Only one person will have to worry about entering in the practice information and the prescriber information. as long as your accounts are sort of linked together through MIT, you will see all those. You'll be able to see them. You'll be able to update them. For instance, if you change practices, and then remove them if maybe there's a location that no longer exists. I would show here the add new practice options. So these are the fields that you'll be given: name, address, the office contact portion.
One time only. Okay.
Sorry, is there a question? I'll keep running through it. So the office contact portion, that name and email there, that will be used. There's a portion of the form that I can show you that's around managed care, sort of communications. If you say there's a need around one of these set areas, or type in the other field, they just want to know the person at the office who they should sort of go back and forth with if they have any questions about coordinating travel or anything that's mentioned as an issue for that particular patient. The same goes for prescriber information. You'll enter it in there. You'll presented the save button, and that's all. Once you hit that, you will go to the first page, which is here. Oh, I think it's taking a second or two to load here. Yeah, so this is the first screen you'll log in. First time you log in, you won't have any patients. So really, outside of if you ever need to go back and edit your sort of profile information, that can all be done through the top corner here. You'll see your name and the little red line appear when you have your mouse over it. Other than that, the thing you can do now is, as the initial user, is this new patient. First time you select that, you'll see those same familiar boxes that we talked about on the profile page. So you'll be able to select these. I'll select my Duet Health as my practice, and then I'll select Jeff Harper, the CEO of Duet Health, as my prescriber, and select next. And as you can see here, this is already one of those places that it fills out. So if you don't select anything and you just hit next without selecting an option for practice or prescriber, these fields will be blank here. The NPI number and practice name will be blank, and you just have to sort of type those in as you go through the form. So you can see how it saves you time to sort of enter it once and be able to have it populate however many times you're entering forms, 20 forms, 30 forms a month, whatever it is. It can add up. The form has a few various different functionalities in it that I'll point out here as we go through it. One of them is visibility. We want to have multiple people within a practice be able to interact with the form. So maybe somebody starts the form and fills out all the information they have, but they want somebody else to maybe go confirm it or add a few additional pieces that maybe they didn't have on hand at that point in time, such as that MMIS number. So a lot of these fields are required. You'll see optional next to these ones. We tried to identify the ones that aren't required. But while they are required, they will still allow you to progress to other pages. So you can see you can hit next on these pages, and it's not stopping you. The issue, or the point where it will stop you, is when you go to try and submit the form. So if I answer no to this question, that they're not a progesterone candidate, you can see the submit button appears here. If I try and hit that submit button, it's going to take me right back to that first page of the form where I'm missing the MMIS number there. So you'll be able to go through it. I'll enter some information here and show you something else that's great about the form, and that's that Save for Later button. So if I hit Save for Later here, that person will now show up on this test patient will now show up on the main page there with the information basically you populated already, all being there. When you click Continue Form, it will take you back to that first page, just to sort of kind of force you to kind of confirm any of the information, make sure it's all there, all populated, so that you don't get kicked back to those required fields when you try and submit it. If you're ready to submit it during that time you're interacting with the form. There's a bunch of other places where it'll be responsive based on the answers that you provide, such as if you say primary answer, their language is not English, it's going to pop up that box that now will be a required field that otherwise wouldn't be when you select yes as the primary language, that English is the primary language. This is another place here. you select yes, you would like them to contact about urgent needs. This is that place where I was mentioning if I'd entered in the information in there, it would populate in these boxes. And these are the sort of fields that you'll be presented. Other needs, it'll pop up with the box to allow you to sort of manually type those in as you're going through that. Are there any questions about sort of the functionalities that, as I've gone through it so far?
Hi, this is Sandy from Family Care Center in Toledo, Ohio with St. Vincent's. With regards to patients that we see that have no guarantor, they're waiting, for their managed, Medicaid to become active or become eligible. We just do it when they, when they get redetermined for their insurance. Is there like a timeline with regards to the notification of the pregnancy, with regards, when they don't have the insurance? Does that make sense?
So I'll try to answer. Are you talking about people who come on as traditional Medicaid fee-for-service?
Well, those patients, and also the patients that have absolutely no insurance, because we will actually start their prenatal care if they have no guarantor. In other words, they absolutely are completely uninsured. And then, once they have insurance, we would, notify the proper, Medicaid plan. But yes, also the fee-for-service ones also.
That's a very important question, and I'm really glad you asked, because this form, as well as any Medicaid form, should not be used for non-Medicaid patients.
Okay.
We're not allowed to have access to PHI for someone who's not covered by Medicaid. So please don't submit it for folks that do not have Medicaid coverage.
Okay. All right. And is that the ones that are just straight Medicaid, the fee-for-service, are we using it? Not just, I'm trying to just make sure I understand.
For fee-for-service, please use this form for fee-for-service.
Okay, got it.
Yes.
Okay.
So even though with fee-for-service we don't cover the home health benefit, it does tell the county that this woman is pregnant and needs to be kept on Medicaid.
Okay.
And it lets the managed care plan know what she needs help with. And if you have identified the progesterone candidacy, the managed care plans are high priority members for every managed care plan. They're automatically flagged as high risk, and they're required to manage them more hands-on than other patients. So
okay, perfect. Thank you very much.
Please put in the fee-for-service in the managed care, but please do not put in either private insurance or individuals that do not have Medicaid yet.
Sure. Perfect. Okay, thank you very much.
Well, Melissa, it's Jay Imes. I want to ask a question about presumptive eligibility and the question that was just asked. How does presumptive eligibility work if this example can't be assured of being covered?
So with presumptive eligibility, my understanding is that you're given a Medicaid ID, and you are covered for 60 days. You're covered under presumptive eligibility. During that time, you apply for full Medicaid.
Right. Does that that Medicaid ID that you're assigned then
yes.
become something that can be used to access?
Yes. So that is a Medicaid ID, the one that you're assigned as presumptive eligible. That is your Medicaid ID. And if you get full eligibility, my understanding is that Medicaid ID follows you to full Medicaid.
Okay, I'm not sure I understand exactly how a woman without insurance presents herself to a care provider and gets immediately enrolled in Medicaid.
I'm not sure if that's true. I'm not sure if it happens immediately, so you would have to delay the entry of that form. I'll have to investigate how long it takes.
The patients that we see, that I see for their intakes, this is Sandy from Mercy St. Vincent's Family Care Center. They often will tell me that they have, they have applied for, straight Medicaid and are awaiting, managed Medicaid enrollment. So, but, I would agree when they come in as, in our system under EPIC as a no guarantor, they really are coming to us without any sort of insurance. So those patients, I will plan on delaying until they're active in with some sort of Medicaid insurance, managed Medicaid.
I'll find out a little bit more about the presumptive eligibility and whether there is, how long it takes to get a Medicaid ID for those folks, and reply to Jalea so she can distribute that information.
It affects how we explain presumptive eligibility to people. It doesn't sound quite as presumptive as I thought it was, I guess.
Yeah, I thought that you could submit the application on the website while the patient was in the office.
This is Jan in the clinic at McCampbell. We're able to do that with our financial counselors. So if they come in with no insurance, they see them and they get their presumptive eligibility and a Medicaid ID right away. But we're finding here, at least because we go through step one, they've already taken care of a lot of that. So we are seeing fewer women come with no insurance.
Thank you.
Okay, well, that's good news.
And this is Gina from Metro. Here in our OBGYN department, we have myself and my coworker, Melissa, who we flag to see the girls who have no insurance. So at that time, we meet with them before their appointment, and we will assess the patient to see if she's Medicaid eligible, and we will do an online app along with running a PE at that time.
And so how long does it take for you to get the Medicaid ID when you run the online app?
Well, the PE, obviously, we get it right there and then, usually when the application goes through, and we also fax ours to the county, along with it getting submitted to the county online. It's kind of up in the air with that, Melissa. Sometimes, sometimes it could take 2 months. It all depends on how fast the county works our applications.
Okay, thank you. Yeah, I'm not in eligibility.
Hi, this is Olga at UH. We have on-site financial counselor through Human Arc, and anyone who enters our doors without insurance goes and sees Human Arc counselor. So the patient may not have a Medicaid ID, but they do have a Social Security number unless they're an illegal immigrant. So as long as you have a Social Security number, can't you still fill out this form based on presumptive eligibility?
I would be hesitant to say yes, because I have been told that we should not have information on people who are not covered by Medicaid.
Even if they're waiting for Medicaid to kick in and we have their Social Security number, we still should not be filling out this form for those patients.
I would not recommend it. If they're presumptively eligible, then it's fine. But if they don't have an MMIS number or a Medicaid ID, I would recommend not filling out the form.
Okay, thank you.
I wish that we could do that we had a universal healthcare system, and that we could, make sure that everybody receives what they need, and that we were in charge of that. But I'm very cautious about accepting data that we don't have rights to.
Melissa, I don't know if you know the answer to this, but I know, like, we have been told from the county that if a patient presents, like, say they applied on their own, and they come in with their application showing that they applied on their own and have that confirmation number that comes with it, that we can run a PE, because at least we have the proof of the application and a confirmation number showing that they have applied.
Right.
Is that,
you can
still
definitely run. Right. You could run the PE, just make sure that they have Medicaid coverage, either presumptive or full, when you enter in the PRAF information.
Melissa, this is Jan again at McCampbell. So the number we get for presumptive eligibility is not the MIMS number, other than for Melina, because it's the same. So we would just enter the Medicaid number for the PRAF form?
Yes.
And then Does
the
it need to,
12-digit number.
does it need to be changed later once they get the MEMS? Because I'm not sure we have a good way to catch that later.
That's one of the things I need to check on, is whether the Medicaid ID is the same for presumptive and full.
Okay.
I had understood that it was, but it sounds like it might not be.
Okay. Thanks.
The MEMS is just another way of saying Medicaid ID. Our legacy system was called MMIS, and our new claims payment is called MITS, and that's too much information for you guys, but I've always just called it the Medicaid ID, and that's what we call it in our analysis department. I think that they're the same, but again, I'll check. I mean, I think that it's the same for presumptive and full. That's to add clarification to that. Okay, anyone else? Do we want Sean to continue?
There's a question.
Yep. Oh,
There's a question.
there's one question.
Okay.
From Robin Lucas. She put on here, so do you want us to submit PRAF if we only have PE?
Yes, if you have presumptive eligibility, then they are Medicaid covered for the presumptive eligibility period. So please submit the PRAF for presumptively eligible or full eligible.
Okay. All right. Sean, you can continue.
Perfect. Just what we're asking the questions, I went ahead and logged into a different account just so I could show sort of the difference between the in-process forms and the completed forms. So this is sort of the main dashboard page that we had on the other one that you'll see when you first log in. And so basically we have it organized so that way the in-process forms are at the top. Those are kind of the higher urgency, you need to finish them up forms, so that's why we put them up there. And then immediately below that you'll see the forms that have been completed. That you can see on this action column where the continue form is for in-process patients, changes to some other options once the form is completed. The first option is the PDF. Basically just download a PDF of the form, whether it's something you want to save the health record or you need to print out or whatever it is. We just had that available. The CSV was just sort of an Excel spreadsheet type format that you can export all the different fields of the form into. And then that last is the prescription field, or the prescription button. You can see it's not present on all of them. So if you choose not to use the form for a prescription, or if the individual in the form isn't eligible for or a candidate for progesterone, they will not have a prescription button associated with their form. So that's really the kind of overview of the system we want to show you. A few small features I'll run through real quick right here just in terms of using it. You can select this and have it just show completed forms or just show in-process forms. Obviously, as you get a bunch more in there, it may be easier to sort of narrow it down that way. And then you can also use the search functionality. So I had a fake patient I entered this morning called Babe Ruth. You can just search Babe in that box, and it will filter that way. If you want to go back to showing everybody, you can just hit that patient tab at the top there, and it'll give you back your whole list of completed and in-process forms. I think that's all I have.
We do have a request in the question box. Can you please go to the home health section? I'd like to see this in detail and the choices.
Yeah, absolutely. So I'll just continue this form that I had started earlier. As I showed you before, it'll jump you back to that first page, and we'll advance to that part of the form. So on this page we will I'll select yes. That'll give me take away the submit option because we have it set up so if maybe somebody didn't, the progesterone wasn't offered, or if the patient didn't accept it, you will get a submit button on this page, and it would remove that next button. But once we hit yes to all those questions, I'm going to ask you to sort of confirm information here. You'll start with those pages, but I can advance through those. And then this is where you would get that home health. So you select that you're doing injection progesterone. You get all the different choices there, the information that you'll need to populate. And the home health piece comes when you select here. So when you select patient, you automatically get this drop down immediately below it, where it'll ask you to choose the home health care company. These are something that we kept up to date. These were the only two that were affiliated with the managed care plans at this point in time. And so you'll select one of those. When you submit this form, then as Melissa mentioned earlier, it's sort of automatically distributed to all these different entities, the managed care plan, the home health company. So they'll receive an email, a daily email that'll say 1 or 10 or whatever the number is, new forms have been added for being affiliated with them, and then they'll be able to sort of instantly log in, take an export of the information, and be able to sort of work on that request to facilitate the injection at the home for that particular patient.
Hi, this is Jennifer from Cleveland Clinic. Can you hear me?
Yes.
Okay. What are the other choices besides Optum? Like, which, is there an other? Because we use Cleveland Clinic home care for some of our patients. So what would I do in that case?
So we don't have the system set up to go to home health providers that are associated with a larger provider entity. We only have the ones that are set up through the managed care plans. So that's Option Care and Optum Alere. If it's for someone else, then you would just fill out the information and then you can print it out and share it with them. Although you might want to check and make sure that their referral doesn't require additional information.
Well, like for CareSource.
Right. So
is there a way to just not even put the home health, because I know it's going to be us? We use CareSource. We use Cleveland Clinic home care for CareSource.
Yeah, so you just wouldn't enter that information. You would just enter that they're a progesterone candidate and then leave the rest of this empty, okay. I believe. Right, Sean?
Yeah, so it's a required field right now. I think what we would need to do, we can add an other option in there, and just knowing that that's not going to get sent anywhere.
That would be great.
That would allow us to through the form and still be able to submit it.
Okay, so this is required then if they do put that it's a injection at the home.
Exactly.
Okay.
So we can follow up on that earlier, but we'll make sure there's a way to sort of handle those, so we're still gathering all the correct information, but not sort of stopping anything.
Okay.
Hi, this is Sandy from Toledo, St. Vincent's Mercy. Melissa, I have a question. The go live date is June 5th, correct?
Yes.
Oh.
Just for the 23 OPQC sites.
Okay. Oh, just for the 23 sites. Okay. Do you want us to, and I don't mean to create, more work and redundant work, but do you think it would be a good idea that we would still have the ability to, fill out the paper form, or at least keep our paper in the event there's a glitch that we would need to fax these, notifications, or you want to leave that up to our own site?
I think that's totally up to you as far as how you want to handle that. I would be hesitant to give you, you must do X, Y, and Z.
Okay. All right. Thank you.
If you could keep track of, what's working, what's not working, we can use that information to improve this if we do encounter problems. Okay.
How long are we going to be live just with the 23 sites before it would be fully live?
It'll be approximately 2 months. And then we'll spread to other sites within the OEI communities. So the 9 regions of the state where we have the highest infant mortality rates.
Mm-hmm.
and
Okay.
then we'll spread from there.
Okay, perfect. Thank you.
Hi, we have another request. If you can show where you print out the completed form.
Yeah, absolutely. So this is on the back on that main page, and we'll go down to the completed section. So the PDF option, well, first I'll show you. If you click on the any of the names, and then click this, you'll be able to sort of see just this form within your web browser. From there, you get the option to have a PDF in the top corner, and that'll download that right onto your computer to open up. And then that same thing can happen from the home page. If you just select that PDF option on this home page here, it'll download that same PDF. Or if you want to download into an Excel spreadsheet, it would be that CSV button.
Okay, and then there is also a question, how do we print out the prescription?
So just clicking this the RX button, will automatically just pull it down on your computer as a prescription, and you can open up and print it out. It's a PDF file, so nobody shouldn't have any issues opening it on any computers. And it'll also, once you submit the form, it'll give you a confirmation message, and just to make it easy, it'll include a link, another link in there to prompt you to download it if there's a prescription completed for that particular form.
Do we have other questions?
So for those of us who are not using the prescription through the electronic form, can we still fill it out and then print it and fax it, or it's not even worth doing it that way?
So Olga, no one can submit it through the form anymore. The only option for using the prescription is to print it out as Sean just described. You click on the RX and it'll print, then you print it out and then you fax it to the specialty pharmacy.
Okay, that answers my question. Thank you very much.
Okay, any additional questions? All right, Sean, do you have any other maybe special tips or anything to keep in mind when filling out the form?
No, I think you'll become very familiar with it after the first few times using it, just like everything else. As I mentioned, Melissa has created a desk gauge that'll help you with any of these questions that you may have as you go along, and as always, we'll be here. We're always here to answer any questions that you have or issues that you may encounter as you go through the form.
Okay, thank you.
I'm sorry, Melissa, this is Sandy. Sure. Just real quick, are we going to be reconvening, we being the 23 sites, in a couple months to see how things are going, or what's the next step after we go live, and then the 2-month period, goes by?
Hi, yes, this is Jalea. Actually, we will have some time on this progesterone partnership call that we're going to have coming up on June 7th. It'll be a couple of days after we go live, so that people have the opportunity to share any experiences that they're having, or maybe any difficulties, and be able to ask questions. And then we'll also be looking to put some time on the calendar. Just be on the lookout, probably within the next few weeks or so, for some additional times in June. We hope to have some virtual office hours where people will also have additional time to be able to, provide any feedback, or also any questions that you may have.
Okay, great. Thank you.
We also have another question. How do we contact Duet if there are problems with the system? Sean?
Yeah, so we're going to be, there'll be a feedback form button at the top here that will allow you to sort of submit if there's any issues that you encounter as you go through the form. So that'll be the best way. That'll get sent to me, straight to me, and we'll handle it as quickly as we can.
Okay, great. Do we have any other questions before we move to next steps?
Hi, this is Olga and Peggy at UH. We just want to double check that as long as it's the same NITS administrator ID, there will be several people in the office who will be like in a cluster working together so they can see each other's work basically, and if a form is in process by one person, then another person could sign in and see those forms and complete them?
Yep, that's absolutely correct. You described it perfectly.
Okay, we just wanted to double check, and I'm glad it's set up that way. Thank you.
No problem.
All right. So then we will switch back to the PowerPoint presentation to review next steps. All right. So I know you probably have also received some communications via our QIC, Kathy Jaworski, also reaching out to you to remind you to ensure that your whole pregnancy notification team is set up to use PRAF 2.0. You'll do your agent accounts created in MITS, and then also have the prenatal visit role assigned by your Medicaid administrator. And I think for the most part, we have most folks that have been able to do that by this point. But just wanted to do that reminder just in case. Also, we would like everyone to be able to test the login to the NurtureOhio site, just at least to make sure that you're able to get in. And then when you're able to do that, if you can please contact Kathy Jaworski to confirm with her that you have been successful, or if you have not been successful as well. That way we are aware that everyone is at least able to get into the system before the go live date. Also during this time, you can take some time to familiarize yourself with the test forms, as Sean was showing you on the screen, kind of how you can create some different patients. But at this time, please do not enter any real patient data until June the 5th. So it will just be test data, and then once we're ready to launch, Duet will wipe out that test data beforehand. Also, we wanted to remind everyone, if you have questions, to make sure that you send them to the progesterone_PIP@medicaid.ohio.gov. This will be very helpful for Melissa to help her to combine any of the issues that are happening with the system so that she has everything in one place and to be able to address those as well. All right. And that will conclude, unless we have any outstanding questions or any final thoughts. Melissa, do you have any final thoughts?
No, just thank you all for participating today and for the really good questions. And I did receive a response from our eligibility folks that the presumptive eligibility ID and the Medicaid ID are the same. So if you enter what you get when you do the online application for presumptive, that will be fine. I do need another, I do have another follow-up just to ask them the average amount of time. I know we heard that it can be as short as 1 day or as long as 2 months to get that Medicaid ID for presumptive. So I do have that in as a question as well. And then just please don't hesitate to use the progesterone PIP mailbox to let me know of any problems that you receive. And then once the button is on the NurtureOhio site at Go Live, if there are any problems with the actual NurtureOhio app, please let us know as soon as possible so we can get things working better for you. Thank you.
One more question.
This is Peggy. Is there any confirmation or like turnaround time between these forms being, patients being identified and then the forms going back in?
What's the expectation for how soon do we need to send those forms in after the patient is seen?
So the online notification through the NurtureOhio website,
Yep.
as soon as you enter it, the people who receive it, the managed care plan, county, and home health agency, they'll all receive that referral the same, or that notification the same day that you enter it.
No, that's not the question. That's not the question. For instance, patient is seen on Monday. Does the form needs to be completed and sent in on Monday, or do we have some kind of a leeway time that we can possibly send it in by Friday?
So that's really up to you. The notification will go out as soon as you send it.
All right.
So I know that's not really answering your question exactly, but Medicaid will not tell you how quickly you need to notify us of pregnancy. The sooner you notify us, the sooner we can update the eligibility system and make sure that women don't lose coverage, and the sooner the managed care plans can reach out to her and identify her as high risk and start providing services.
Okay, thanks a lot.
I have questions for the other nurses that fill out the PRAF forms now. In my office, if a patient does not have insurance, I just kind of circle it on a list. But to be honest, I don't have a foolproof way of going back and looking each month to see if a patient has gotten insurance to fill out a PRAF form for them. Does anyone have any ideas for how they keep up with that?
Hi, this is Sandy from Toledo. The only way that I'm able to do that is I would fill out the paper skinny form and indicate, no guarantor, and just kind of keep those papers and track the patient that way. So I may still do that, even though we're going to switch to electronic, but just kind of old-fashioned paper.
We don't track those patients right now. We have no way of going back and figuring out when they got their insurance and do the form at the next visit. We just don't have that capability.
Yeah, I know that. I know I miss people because I just don't have the time to go back and look at old forms.
No.
Try to catch all of them.
Right. Unless they're indicated as a new OB and our front desk can flag them and give us those names, we have no way of tracking them at a later visit.
Yeah. Thank you.
Hi, was that Brittany speaking by chance?
No, this is Brittany.
Okay.